thank you everyone for coming. Greatly appreciate you all being here. So, one of the reasons I got into healthcare was to recognize this type of work. We really do look out for patients and families, and sometimes we get so caught in the weeds of what's not working, what we need to fix, that sometimes we forget about the important stuff that we do and the impact that we have on our patients, on our community, on our families. So with that in mind, I'm going to hand this off to Bruce.
We nominated Dr. Vickerman for the award because of the exemplary care Dr. Vickerman demonstrated in the care, diagnosis, and most importantly, coordination of care for my wife, Pam. Thank you. My wife and I are new to Colorado, came in for a day of appointment for just her cough and her asthma. She was feeling pretty crappy, to be honest. She was fortunate enough to get Dr. Vickerman, who took her, listened to her. She had sent her for an x-ray. The x-ray came back showing an 11.5 centimeter mass in her chest. The x-ray then led to a CT scan, another CT scan, and this is all happening within a period of days, I may add. At a time, my wife's stressed because my son's getting married. And of course, my wife's now worried because she knows she's got the mass. She knows that son's getting married. As all the things are pressing pretty quickly, we don't know what she has. And my wife's very worried. Dr. Vickerman's making sure that she's coordinating the care with Dr. Urquhart. He thinks a PET scan is going to be the better way than going to the thoracic surgeon. And it showed what her diagnosis was, which is acute lymphoblastic lymphoma, a fairly rare disease. But it's Thursday evening, right before a holiday weekend. Both Dr. Vickerman, Dr. Urquhart immediately get on the phone, make arrangements for my wife to be accepted at the University of Colorado Hospital that evening. Because we got in that evening meant that Friday morning my wife was able to get the bone marrow biopsy done before the hospital closed for the holiday weekend. It meant that she was able to get the chemo started almost immediately, and it started the progression of her getting better. It was because of your empathy, it was because of your caring, it was because you did all of the things that you did that she was able to get on the path that she was on.
That's a lot more than it is.
I couldn't do this without the team here, and our goal is patient outcomes, and we're here till sometimes 7, 8 o'clock at night. Ted knows, I work 7 days a week, and I really care about my patients.
And it shows.